Hello everybody and welcome to Bedford Hospital Maternity. This is our Signet wing and most of you will recognise this entrance. The majority of you will use this entrance when you come in for your antenatal clinic appointments or your scan appointments. If you are coming in labour, you will probably most definitely use this entrance. So this little video is really to give you a bit of a tour of our unit. Pre-COVID we used to do walk around tours for you on a Saturday and Sunday, but obviously in light of COVID we're not able to do this. So we've just done a short little video so we can give you a bit of an idea of what to expect when you're actually coming in labour. So the first thing I wanted to point it out is your lovely pregnancy book, which by now you are all very familiar with. Before you come, we really like you to phone us, okay? And when you phone us, we will ask you for your hospital number or your unit number, which can be found on the first page, and it will either be on your sticker or it will be along this top bit here. Now it's really important that we know you're coming, because obviously these babies decide to come when they want to come, and that does mean that sometimes we have to do a little bit of moving around of staff to make sure that everybody's in the right place in order to look after you. So when you come in the day, obviously the doors are open and you can make your way straight up to delivery suite. If it's at night time, these doors are actually locked and you will need to buzz on the entry system, which is just over here. You'll buzz up to delivery suite, give them your details and they will let you in. The other thing to say is obviously when you arrive in labour is parking. That's one of the things that is on people's minds, and we will show you a picture of the parking charges and also of the parking hut, which standing here is directly opposite where you can go, and if you know you're going to be here for maybe a couple of days, you can buy a discounted ticket at the price of £15 and the parking ladies and gents will sort you out with that. You'll notice the yellow lines out the front of Signet wing. Now you can park here if literally you're bringing your partner and they are unable to walk any distance or are in the throes of labour. That is absolutely fine to drop off and take your partner straight upstairs. However, it is really important, unless your partner is physically giving birth, that you come and move your car. This is an ambulance area and obviously needs to be free for use for ambulances. So that does mean that you will get a ticket if you're parked here. Now parking can be found the whole way round the outside of Signet wing, and there is also a car park just off to your right from this position. So once you've come through the double doors, you'll see another set of double doors which you make your way through. Important to remember that we're still asking you to wear a mask when you come into the building, and when you first come through we'll ask you to hand sanitize your hands. As you come through, there is hand sanitizer here. Please take a moment just to stop and do your hands. So there is two routes up to delivery suite. You can either go up in the lift if you don't feel like doing the stairs, or you've got your stairs here where you go up to the first floor. Okay, so once you get to the top of the stairs, you'll see some doors to your left with delivery suite and acorn suite. You come through this way. And then you'll see to your right is the lift. So if you come up in the lift, you come out of the lift and go directly straight ahead to delivery suite. So once you get to the doors, you'll see a buzzer system where you need to buzz, and then the maternity staff will ask you who you are and then let you in. So once you come through the doors, we just ask that you would sanitize your hands again. Once you've done that, we ask you to move over to the reception desk on delivery suite, where one of the midwives will ask for your notes and take your notes off you. So once you arrive on delivery suite, come to reception, have your notes ready and pass them over to the midwife, who will then very politely ask you to go and wait in our triage area. Thank you. Thank you, Susie. Okay. So once you've handed in your notes to reception desk, you might be asked to come and wait in the waiting room or go straight through to triage. This is our waiting room. We just ask you to take a seat here. Just reminding you again, partners, please keep your face mask on at all times. Ladies, if you're not in labour and you feel comfortable wearing a mask, please wear a mask. But if you're labouring, then we do not expect you to wear a mask, okay? So when you arrive on delivery suite and you've been seen in triage by a midwife, and we know that you are staying with us, in other words, you are having your baby, no going back now. As you come round onto delivery suite, there is 8 single rooms, which are called our delivery rooms. If you are in established labour, you have your own room. We also have a theatre here on delivery suite, but we'll come back to that. The single rooms on delivery suite don't have ensuite toilets and bathrooms, but you will see dotted around there is various toilets and bathrooms that you can use. All the rooms sort of follow round in the corridor system. So then when we get to here, this is where we're entering our midwife-led unit, which is Acorn Suite. So rooms 7, 8 and 9, which I'll show you in a minute, are all off the end of delivery suite here. Now, room 8 and room 9 in the Acorn Suite do have ensuite bathrooms and toilets with them. So our theatre here on delivery suite is actually here on the same floor, so you don't have to travel very far. We have our theatre here, and then right next to our theatre is our 2-bedded recovery area. Because once you've had your baby, you'll go into there for a little while. Okay, so this is one of our standard birthing rooms on delivery suite. All the rooms are pretty much set up in the same way and have the same equipment, but we just thought we'd give you a little tour of the room. All of the rooms come with curtains that come all the way around here, so if your door was to be open, nobody can actually see you, which is very, very important. All rooms come with a standard birthing bed. Now this looks very boring, but these beds are really good. You can make them into all different sorts of positions, so you can have sitting up, you can have them fully into a chair, the legs of the bed go down, all sorts of different things, so you don't have to have it just completely flat. Once you come into one of these rooms, pretty much we know you're in established labour and you're staying with us. So we would always advise you to leave your car seat downstairs in the car, because as you can see, the rooms aren't particularly massive. Just bring up your bare essentials. Lots of ladies ask, do I need to bring anything from home in terms of sort of towels and bedding and things like that? No, you don't. We have everything here for you. However, I do know that some ladies like to bring their own pillows, especially because that's a bit of a home comfort, and that's absolutely fine if you would like to do that. Very much once you're in the room, this is your room, and we'd like you to make it to feel as comfortable as it can be for you. You can see at the moment we've got the really bright lights on, but we have got lights over the bed that create a more darker, dimmer environment. You can also bring in as well, people often ask about candles. Now obviously we're in a hospital and we've got piped in oxygen and Entonox, so candles are a no-no. However, you can absolutely bring the battery operated candles or battery operated fairy lights, all of these sort of things to make the environment nice and cosy and homely and relaxing for your birthing experience. The same as people ask about, can they bring diffusers for different smells? That's absolutely fine as well. You just need to think that anything that's plugged into the wall needs to be pat tested by the hospital. So where possible, use battery operated devices so that we don't have any issues on that front. Gas and air, or Entonox, is piped into every room. You can see here, and it's on a very long tube, and this is available in every room. If you were to have Pethidine as an option, that is an injection that is given to you, and that can be done in the room as well. The same as if you are opting for an epidural can be performed in the room. It does depend on the situation. For example, if we know that you're going to theatre, for example, then the epidural may well be done in the theatre. But if you're having an epidural for pain relief during labour, that can be done in the room, and the anaesthetist will come into the room and do that with you. So you'll see that each room has a locker for you to put your things in. Each room has a sink, and each room will also have a little cot for baby, for when baby arrives. The other things I wanted to point out was the call bell system. So every room has a button where you can press, and this registers at the midwifery station, and then they can come and answer the call bell for you. Also very important to point out is this red buzzer here, which we call our emergency buzzer. And sometimes the midwife, if it's just you and a midwife in the room, may ask partners actually to pull this buzzer. I just want to highlight it, so to make you not scared of it really, because lots of times we may pull this buzzer and then by the time everybody comes running, actually the situation that we thought might be occurring has been resolved, or actually we don't need assistance. But essentially this buzzer is about when we need somebody to come, and we need somebody to come now, and that alerts the whole team and they will come to the room, okay? The other thing to point out to you is the resuscitator, because obviously this looks a bit scary, and I'm just going to turn it on because as you see it makes a lot of beeps. When we know baby is coming, we bring one of these into every room. So this is not because we're worried about your baby, this is standard practice. And we don't want you to be scared of this, so we like to highlight this out to you. Now what this does is obviously gives us light and heating, and if we do need to do anything with baby, we've got everything here we need to. More often than not, we just use it to heat up the towels and heat up clothes because it's a lovely warm environment space. Okay, so just want you to be aware of that. Every room has also got a cupboard which is full of all sort of clinical midwifery sort of things, but it's pretty standard in every single room. The other thing to remember as well, we have at the hospital, we have birthing balls. So we've got a few balls that you can use, and we've obviously got different sizes as well, because obviously some of us are very small like me and others are very tall. The other ball that we have for you to use is what we call a peanut ball. Now this is used more for ladies that are not as mobile. So let's just say you've been labouring but you want to have a little rest. You want to lie down, you can pop this in between your legs, and what it does is help to keep your pelvis open. This is also really good for women that have had an epidural as well and that can't be mobile. It's really useful. So these are the things we've got for you to use. We also have some mats that we can put on the floor, so if you wanted to be kneeling, that is also an option too. So moving on to baby. Once baby arrives, we will put little name tags on baby, and the information that we put on these tags relates to you, mum. So we know that mum and baby are linked together. One will go on the wrist and one will go on the foot. And we ask you to make sure that these stay on baby for the whole time that you're in hospital with us. We've also talked about the security, the new security system, and the little tag that goes on baby's ankle. If you're not going home directly from delivery suite, you'll come up to Orchard Maternity Ward, which is on the second floor above delivery suite. More often than not, you come up in the lift, so you'd come straight out of the lift. Once again, there's a door entry system, so to gain access, you need to buzz and say who you are. Now, it's at this point at the moment where we ask birth partners to then actually go home. At the moment, there is currently no visiting or birth partners allowed onto the ward. So once you're on the ward with us, this is our dining area. You can come in here at any time if you want to get fresh water, cold jug of water, hot drinks, toast and cereal. And then at the scheduled meal times, all the food is placed out on here, and you can come and help yourself to anything you'd like. If for whatever reason, let's say you've had a cesarean section and you're not yet out of bed, and then our lovely hostess will come round and ask you what you'd like and bring you food to your bed. Okay, so when you arrive on Orchard Ward, we have four bedded bays, so there's 4 women in a bay, and we have 4 single rooms, 2 of which are private rooms, and this is one of them that we're standing in now, where you can pay to spend the night in here. We also have a 5th bay, which is what we call our sort of high dependency bay, and this is based behind the reception desk on Orchard Ward. And if you've had a caesarean section, or if you have been unwell and we need to keep a bit of a closer eye on you, and then we like to keep you in there for at least the first night. We don't really want anybody down in these single rooms if they're not mobile and on their feet, because obviously you're a bit further down the end of the ward and we need to know that you're okay and safe. You can request to have a single room. You can't book these in advance. That's one of the big questions that women often ask is, can I book a single room in advance? And you can't, because it really depends on the activity within the hospital at the time. Now, Orchard Ward, the bays and the rooms, they're not massive, so our advice is always to leave your car seat at home or in the car until the point when you are ready to go home. And the same with your bags as well. Keep it to a minimum, just pack the basics. One big question during COVID time as well is what if you run out of something? Let's say you run out of nappies or you need some more clothes. Your partner can absolutely bring things up to the ward, and the midwives will take the things off your partner. We won't allow them onto the ward at this time, but they'll be able to collect any belongings and bring them to you. So that's not a problem at all, so don't panic on that front. Bed has a call bell system, so similar to when you're down on delivery suite, you'll have a call bell to hand where you just press, and that will register at the midwife station and they will come to you. So when it's time for you to go home from Orchard Ward, and this normally happens once you are fit and well and have had all of your checks, also once baby has had their neonatal infant physical examination, which needs to happen within 72 hours of birth. So we try to get that done before you are discharged from the ward. Your baby will also have a hearing test while you're with us here on the ward. Once all of those things are done and you're ready to go, you can then ring your partner to arrange for them to come and pick you up. You do not have to go downstairs on your own. We will help you get downstairs with all your bags, or your partner can come up to the door and meet you, and we can help you get downstairs, so please don't worry about that either. The other thing they'll have is a little security tag, and we've quite recently had a new system put in place, so this is different. So if you're having your second, third or fourth baby, this is going to be different from what you've seen before. So then if you were to take baby off delivery suite, or you were to take baby off Orchard Ward, and then this sets off an alarm. So this will also need to be taken off before you're discharged, otherwise you walk out the building and all the alarms go and we all come running after you. So when you and baby are ready to go home, we're going to send you home with some paperwork as well. Your book is this darker purple and baby is a little bit lighter purple. These go home with you and they have all your details in about your birth, all the baby's details. There is also lots of information in these books to help you about feeding, routine care of the newborn, and about looking after yourself post-delivery as well. So there's lots of information in them. On the front, you'll also have all of our contact numbers, so that once you're home, if you need us at all, you can call us whenever you need to. Please remember, we're just at the end of the phone, and there is always somebody here day and night. We're also going to send you home with a little pack of leaflets, information leaflets. One of those tells you how to register your baby's birth, so that's very important. There's a leaflet in there about where to get feeding support in and around Bedfordshire. And there's lots of different things in here about reminding you about your pelvic floor exercises, being alert and vigilant for the signs of jaundice in the newborn. So there's lots of things we'll send you home with. And once you're ready to go, you can ask Dad or whoever is taking you home to come up to the doors and we can meet you. If we need to help you down to the car, we can. We do like baby to be in a car seat when you're going. If you have the sort of car seat that is just one that's kept in the car, then please just bring the pram or the pushchair up that we can put baby in to get you safely down to the car. And at that point, that's it, we'll let you go. In terms of visiting postnatally, so you normally receive a phone call from a midwife the day after you're home, so basically after your first night at home. Depending on what day that is, that will just be a sort of conversation to see how you and baby are doing. From that, it might well be that we need to see you, so we can arrange an appointment to see you. But as a rule, we see you on day 3, day 5 and day 10. And then any other visits in between that depends obviously on the current situation, if you need extra feeding support or anything like that. So that's basically how it will work. At the moment, your postnatal appointments are pretty much all held in the children's centres. If you've had a caesarean section or you're particularly unwell and not as mobile, and then the midwives will come and see you at home for your day 3 visit. But by day 5, we try to get you out to come to the children's centres.